work a lot. There's high movement areas, like in the neck. You know how we get that trigger.
Like right now,
I have one
right
here.
It's pissing me off.
Yeah, and so so we've mapped out probably over 200 spots in the body that these high traffic movement areas develop these knots. And so by massage, by stretching, and so myofascial treatment is a lot different than fiber. So if we did take a look, we can probably come up with some ideas for you to say, you know what, it's looking like you may have that, and then I can give you some ideas and then get you to the right people.
Can you have both?
Yes, you can.
Mm-hmm.
Yes, you can. And that's the key thing, though, and that's the key thing that I want you guys to understand is they kind of go hand in hand. Most of the diagnostic criteria is pretty clear, but a lot of people, because we don't move as much, you get the tender, you get that.
Thank you.
Yeah.
I've been like searching for answers.
Yes, yes.
Now, because I've heard that they've talked about chronic fatigue as being an autoimmune disease, and I've also heard that it could be hormonal in other areas that I read. So, and now with the real question I have, RSD, they have linked it. I researched to find that it was your sympathetic nervous system not switching off.
Correct.
And now that I've heard that it could be an autoimmune disorder.
They're linking it to genetic too, and also chronic fatigue syndrome, genetic. And they're also looking at with the complex regional pain syndrome. Sometimes it can occur by the area getting damaged somehow, like there's an injury to the area, and the nerves in the area become super hypersensitive. And so, because you got to remember the definition in orthopedics is any type of pain that lasts over 3 months is considered chronic pain. So that means you have the spinal cord adapts, and that's when all those pain hormones are really off kilter. So with complex regional pain syndrome, anything cold, heat, any type of sensation flares it up. And so that's why they call it a sympathetic. And so they're trying to find out, why is the brain making this area so sensitive? That's when they're having all those effects. Is it hormonal? Is it environmental? Okay. Also, is it genetic? Is it allergies? They're looking at allergies. Yeah, that's what the latest research coming out. Is it linked to allergies? Should it also be considered with the chronic pain disorders like fibromyalgia, CFS, different myalgias, rheumatoid arthritis? Should it be in this whole category? So complex regional pain syndrome is the new name versus RSD, and it's getting a lot of traction right now in the research. A lot of nerdy guys are looking and saying, what is it going on? And I think we're going to find out it's the same thing, that it's coming into the deeper brain centers, and it's coming off. So eventually, wouldn't that be cool if we had a pill that would restart things and set our hormones straight? Hey, I'll take that pill. Does that make sense? So there's a lot of stuff on the horizon, but I think a lot of these disorders, even lupus, okay, we got to look at all the other soft tissue stuff, lupus and all these other things. I think there's a whole neurological, hormonal, we call it neuroendocrine component.
Yeah. There was kind of a far-fetched theory, and I had a doctor that actually said he'd be willing to do it, was the ketamine treatments.
Ooh.
And
Special K?
Yeah.
Oh, yeah.
And that was...
That'll change the brain a little.
$900 a pop, and of course no insurance covers it, but he was kind of, not he specifically, but there was a doctor out of Boulder that did it on himself, and he, at the time that I read about the study, he was, I think 6 months symptom-free, and it just went in, and it just basically is supposed to be a reset on your whole brain, and it just basically shocks you, and just, it's a 3-step process. So you go in and get one treatment, and I'm not sure what the spacing is, but obviously it's not going to be very well accepted in the medical community and insurance companies and stuff like that, but the theory, and it just seems like such a weird and mysterious thing. It can be triggered by nothing. very intriguing to think about this whole reset idea because, like you said, you get so far out of balance, and like anything, any type of gyro starts to get out of balance, it's only going to get worse and worse as time goes on, unless you can reset it.
Well, and also Dr. T, the shine thing, I'm talking about Dr. T right now.
I heard you.
Yeah. Dr. T has a big theory that is coming from the hypothalamus.
And that's something that's not, because to me when you start thinking about your glands, and then it just sounds like trouble. You're never going to get that thing fixed.
Well, it's kind of one of those big controlling glands that kind of turns on all the other, so it's kind of like that step down process. So the hypothalamus is kind of like one of our things where it also regulates like our temperature and all that. So it's kind of one of those things where if it does turn off, it kind of screws up the rest of the chain. It's kind of like the electrical grid, right? It's kind of like a transformer busts, and then the electrical grid's down. So sometimes we're thinking that our electrical grid's down, and then it can kind of be reset. So it would be kind of interesting is that if I wonder if we can shock the body at the cognitive level sometimes, or do something to kind of reset that. And so that's one thing I'm looking at too, because when I watched his video years ago, I followed him for years. He's pretty well researched, and he had it. So even though you have the testimonial there, you got kind of like a Dr. Oz guy, because Dr. Oz, we see him on New York Med. I mean, that guy's the real deal. Yeah, but this guy's a real deal too. And so I think the video is kind of cool when you check it out, because I watched it again last night just to kind of make sure that I was seeing it. But it was last year, so I didn't see it. It was new. But he's pretty good. Check it out. And he's got a couple of good ideas about hormonal. And I think what you were saying, how you said that you went to the natural pass?
Well, in Washington State, they have as much control and power as regular MDs.
The licensure's
And
great.
Beth Deer is there, and I worked with a lot of people who are connected with Beth Deer and stuff.
Yeah, you guys. So some of you guys, so some of this, alternative medicine stuff's pretty cool. Because he works with integrative medicine, that's what they call more the naturopaths here in California and the rest of the world. But Washington State's one of the only states that actually takes a naturopath who studies as an MD, and they actually have full licensure. So it's kind of interesting because because you know what they do? They take a different look at the body. It's kind of like an osteopath. They're not just straight diagnosis meds. They don't give you an ICD-9 code and say you got fibromyalgia, which is 2.2 whatever it is, the diagnostic code, and give you
They do
meds.
all the esoteric testing. I lived in New York before that, and only person I could see there was a psychiatrist. She just gave me medication. She tested my blood work and said it was healthy as a horse. And it wasn't until I got on the West Coast, and especially in Seattle, where they did all the esoteric testing that showed all these things whacked out, in my body with the hormones and all kinds of stuff.
Yeah. So it's interesting, I know, and so I still think that there's a lot of cool things and stuff like that. And gosh, I wish I could do everything. but I can at least I gotta pick one down first.
I have kind of a strange response, and I wonder if anybody else has ever experienced it, but it seems to be pretty consistent.
Hi, guys.
Bye.
Bye.
Thank you.
I hate this in response to heat. Obviously your tolerance is down, even just being outside in hot water can just kill you, but hot water, I can only stand, say, 15 to 20 minutes of a hot shower, and then my body will literally just start to shut down, because I will need to lay down and get to the floor. So
20 minutes of a hot shower? That's a long time.
a little bit
How about
OCD.
5 minutes and then moderate and then cool down?
It's old habits are hard to break, but
You have to break
Gosh,
because
yeah.
that's actually affecting you not only the
timer on.
but also the chlorine and fluoride.
Nice to meet you.
Just full of it in our water.
and
Super
like
important.
Katie said, I've got
Yeah, just trying to
We all do. We
But
all
it feels
do.
like
I know, it's a really,
high
people just don't
sensitivity
understand it sometimes. I guess.
So it's like, that whole whatever, it's the hypothalamus. Whack
I don't like
So
that.
there's something early on I was kind of mysterious.
Because,
I mentioned it to
it really bothers me that
and
just
sometimes if I'm in a flare, it
guys are still.
can be almost immediate. I'll step into a hot shower and I can feel
Does that make sense?
my muscular system just
So it's tough.
get away.
Right. Have you read his book, Dr. T's book?
There's an inflammatory
I've tried
component
some of his
with